One of the common concerns about IVF is, am I more likely to have an abnormal baby? The answer to that question used to be possibly. But today we have methods of testing women, testing their embryos, the fertilized eggs, doing a procedure known as PGT.
Now, just because we can do something doesn't mean we should. And PGT-a, it's one of those things that's being overused big time. So this doctor says that PGT, also known as pre-implantation genetic diagnosis, is a way to check embryos for genetic abnormalities. Most people talking about this are actually referring to PGT-a, which is pre-implantation genetic testing for aneuploidy, which is unfortunately pushed on every couple doing IVF like it's some kind of quality check for their future baby. Here's the truth. If you're a young, healthy couple with no known genetic risk, PGT-a is overkill. It's not some magical test that is going to guarantee the perfect baby for you. In fact, I have seen couples going through PGT-a transfer an embryo that was supposedly normal and still end up with a child with significant abnormality. Why? Because PGT-a is not foolproof. It tests a few cells from the embryo, but embryos are very complex. A bad PGT-a test result doesn't always mean that the embryo won't be fine, and a good result doesn't mean that it's 100% problem free. And let's not forget, biopsying an embryo is a trauma in itself. You're literally taking out a piece of something that is still developing. If it is necessary, like when there is a strong family history of specific genetic disorders, then of course it's going to be a game changer. But if it is just being done because the technology exists or you just want to be extra sure, that's when it becomes unnecessary. Bottom line, PGT-a is not a universal must-have in IVF. It has its place, but it's not a 100% guarantee, and it shouldn't be used just because. So if you're being told that you must do it, ask why. If there is no strong reason, get a second opinion, because more testing doesn't always mean better outcome.